So again, welcome everyone. Thanks for joining us today for our monthly virtual office hours. This is really an opportunity for you to learn a little bit more about the Congressional District Health Dashboard, and we're happy to answer any questions that you have. So until now, rigorous nonpartisan data on health and conditions that affect health have not been widely available at the congressional district level. That's why we launched the Congressional District Health Dashboard, to be able to do that. We provide granular data at the district level. It's straightforward data, unbiased, and it's really to help inform and catalyze priority setting. Our audiences for the dashboard are elected officials and their staff, advocates, journalists, researchers, and the general public, really anyone that can benefit from having this type of data available at the congressional district level. We launched in 2023 in January with the new Congress that started at that time. I believe it was the 118th, and we're now in the 119th. It's been a good ride. We're still on it. We built the dashboard based on our expertise with the City Health Dashboard, which we similarly created to provide folks health and health-related data at the city level, where it's also challenging to get that data. So I've been talking about data, health and health-related data. These are all of our measures for the Congressional District Health Dashboard. We have 40 measures across 5 different domains. Those domains are health outcomes, where we have typical health data that you see, like deaths-related data and disease-related data. We also have social and economic factors. You'll see broadband connection, children in poverty, some education measures, unemployment. For health behavior, we have several measures like binge drinking and physical inactivity. The 4th domain, physical environment, includes air pollution and some lead-related measures. And then finally, under clinical care, we have several measures that include insurance as well as access to care. For all of these measures, you can find data for your congressional district, state, and as well as the national average. We have another little bit of information on this page, which is that for some of our measures, we have demographic data available. That's by sex, race and ethnicity, and age group, depending on whether it's available at the data source and it makes sense with the measure. And then also for some measures, we have census tract level data available. Similarly, if it's available sort of at the data source, then we provide it as well. And that can be really helpful when you're looking for differences within districts. So the approach that we use to adding measures or including measures on our dashboard is that we looked for national data sets so that we can provide data for the entire country. We also look for rigorous methods underlying the original data collection. Our team of experts vets our data sources and makes sure that they are validated, that they make sense, that they represent what we're trying to share. Our measures also reflect public health priorities. They're updated regularly. We do annual updates for all of our measures, and for Medicaid enrollment, we've been updating twice a year. And then finally, the measures are balanced over 5 overarching domains. There are really so many factors that influence health that it's important to have really those core public health outcomes measures, but we also want to share some of the drivers of health or structural and social determinants of health. Before I launch over to the website, I just want to say a word about our partners. We are funded by and we partner with Robert Wood Johnson Foundation in order to provide this data and the website. And two of our other partners that really helped develop and launch the dashboard are the Bipartisan Policy Center and the Center on Budget and Policy Priorities. Before I go over to the website, are there any questions in the chat? No. I don't see any questions, but I see a nice representation of folks from across the country. We will I'll try to use your districts to kind of show the dashboard when I go into the demo. Okay, great. So this is our landing page. I'm gonna get out of the slideshow so I can see you guys better. So I've got two screens. So starting from the home page, you can type your district in if you know what it is, or enter the address by zip code. And that's, a similar tool that's available when you're looking up on house.gov. So the first thing we'll start with Florida 22nd, Judy, because you're right here on the screen with us. So when you type in your district, the first thing that's going to come up is the health snapshots page. That's the, from our homepage. The health snapshot is every single metric that's on our website. It gives you the measure for your district. So you can see what the estimate is for Florida 22nd for every single metric on the website. There's a few ways to look at this page, and I'll just start by saying you can filter over here if you're interested in specific metrics. I'll say we're interested in Medicaid enrollment, maybe uninsured, frequent mental distress, and opioid overdose deaths. So all of those have populated the estimate for that district and then the comparison to the US average. We also provide this symbol that indicates whether something is above, below, or similar to the national average. So we can see easily sort of how Florida 22nd is doing in comparison. I'm going to maybe clear the filters. Don't want to make Florida 22nd look bad. So we have to see some more greens over here. So routine checkup doing better than the US average. I wanted to show the green circle too. So if you're interested in a particular metric, like I said, you can filter, you can see the estimate easily, the comparison. If you're interested in learning a little bit more about, what this measure looks like in the state, we can go over to binge drinking since that's on top here. If I click on that, it's going to take me to our metric maps page, which is like another way that we have of looking at data, understanding it, comparing to nearby districts in a visually friendly way. I'm going to zoom out just a little bit so you can kind of see surrounding districts. So we're able to see for this part of Florida how the district, the 22nd district, compares to neighboring districts. And we also have this scale bar along the top and sense making statement. So you can kind of say, okay, in sentence form, what does this actually mean? Okay, Florida's 22nd district had an estimated 14.2% of adults report binge drinking in 2022 compared to the national average. And then you also have that represented on the scale bar. So we try to provide users ways to look at and understand the data in different ways. On this left side column, I'm just going to point out a few things. If you wanted to change the metric, you can change it here. So you're looking at binge drinking, but you want to look at something different, but with the same view, you can do that. You can also change the year that we have data, the year for the data that you're looking at. So you can look at some kind of change over time, or if you want a specific year, you can look at it. Another thing that we offer is if you are operating more, within your state, you may be interested in comparing the district to the Florida value. So even though it's pretty different from the national value for binge drinking, it's actually pretty on par with the state of Florida. And then lastly, I had mentioned that you can see census tract level data for some of our measures. Binge drinking is one that you can. If you go into show census tracts, it will load for the district that you're interested in, and then you can actually click on individual census tracts and get the estimate for those. So you may be familiar, within your district with a specific neighborhood that's similar to the census tract shapes, and you're able to, see what's going on within the district. I think that same, what I just did where you can click around on the map, the same thing applies when you're looking at the map. In this way, you can click on this district and see values of neighboring districts. So that can be really helpful if you're looking for allies within the Florida congressional delegation, or just trying to compare values across the state. I'm gonna zoom out also just so you all can see. If you wanted to go into, to just start on the metric maps page, I'm going to pick a different metric, children in poverty. So instead of, saying, oh, I know I want to look at this specific district as your launch into the website, you would say, oh, I'm actually interested in a specific issue or metric. So you might start with children in poverty, and then you're going to get the national landscape for that. You can very clearly see where some areas are struggling and where some areas are doing better on this metric. And then you can click around, see what the different estimates are for different areas. And of course, you can zoom in if you're interested in seeing a little closer. And that's definitely necessary for some of our denser urban areas. Finally, the feature I just want to share, because it's been one that's been really useful to me, is the map and scale bar. You can download these images. So wherever you are, if you've selected, this measure, this district, and this particular zoom view with a, say you're doing the US comparison, you'll get the US comparison scale bar. And if you did the state, you'd get the state comparison scale bar and the sort of state view map. So we created that so that, if you're using materials and presentations and stuff, you can easily pull the visuals so that you can reference that data easily. The next thing I am going to share with you about our website is just kind of going back to the top bar. So we've done health snapshots. We did metric maps. The next one is metrics by demographic. So I mentioned before that for some metrics, we have demographic data. I'm going to choose Diane's California 19 for this one. So after you enter a district, you'll get a list of all of our metrics, but the only ones that have demographic data are the ones that you're actually able to click on. So we don't have demographic data available for diabetes, so it's grayed out. I'm going to go to uninsured for this because I think we have for uninsured data sex breakdown, race and ethnicity, as well as age group breakdown. So for this section, we just provide the scale bar and then the sense making statement so you can understand. Sometimes when I look at scale bars or a whole bunch of numbers, I'm wondering what I'm actually looking at, and the sense making statements help orient you to what this means. So for race and ethnicity breakdown, you can see across categories sort of what the differences are, compared to the overall district level average. And then similarly for age group, you can see where some populations may be more vulnerable than others, or maybe doing better than others. Similarly, like with the metric maps view, you can change the metric here, you can change the metric time period, and you'll get you can look at some change over time where it makes sense, or you can look at other metrics that have like high school completion, where we have demographic breakdowns by the 3 different categories. For some, you won't have all the age, or you won't have race and ethnicity, or you won't have sex, and it's just, again, based on the data availability. So we encourage you to click around and see what you can find for what you're interested in. The next feature I'm going to share with you is the compare districts. So I was, when I was under metric maps, I was showing you different ways to compare neighboring districts and how to sort of visually see that. I'm going to choose another measure that we have, frequent mental distress, which is a measure of mental health. And I will do, is that Kentucky 6th? Okay. So this is frequent mental distress for Kentucky's 6th Congressional District, which looks like it includes Lexington, and Richmond, and probably some other cities too. So for this page, we're able to actually add in districts and states here. So I'm going to add Kentucky, the state. I'm going to take a gamble and try Kentucky 5th, see if it's maybe it's a neighboring district of Kentucky's 6th, and you'll see it populates these cards down here where you can visually see differences and scale bars at the top. So this is really similar in principle to the metric maps view, where you're getting, scale bars and map visualizations, plus sense making statements for each geographic area that you've selected. And then always along the top, the comparison to the US average. So again, these can be really useful for presentations. If you go to print page, you're able to get a nice PDF version of this. It won't split things across the pages. We set it up that way so that folks could, grab the images as they need to use them. Another positive, I guess, on this page, just to point out, is that we have the source at the bottom of each of these cards and the year of the data. So that's just helpful, especially now when you're communicating about data, saying where it's from, where and when it's from, to help folks feel like they can trust it. The last thing is really not as much of a feature, but just for your information. We have background information on all of our metrics here. So just kind of getting into, where's the data from? How do you calculate it for the site? Every single metric, we are transparent in providing the information about where the data comes from. It's a simplified formula, but providing a calculation for how we get it. And if you're interested in exploring it more, if you're more data savvy, there are resources to our technical document. And we actually even share, what table in the data source the data is from. And we also share why we've added this metric to the website. If you're interested in, what's the public health rationale for being interested in or concerned about children in poverty in my district, what are some other connections to health? You can find that kind of information here. I had mentioned, if you're interested in the data, if you're tech savvy, you can also download the data. So there's, under this like hamburger menu up here, you can go down to access the data. If it's your first time visiting this page, there will be a pop-up that asks you to just give us a little information about who you are and why you're downloading the data. That just helps us understand like who's actually interested in downloading data. So if we're making improvements to how we share the data or allow it for download, it's just helpful for us to collect that about you. It's not to add you to our newsletter from there. But if you do want to be on our newsletter, you can come down here and click on the subscribe link. So back to downloading the data. We have recently updated this tool to make it a little more easy for folks. You can either download by selecting a specific metric, say you're interested in education, youth, I'm thinking youth not in work or school, children in poverty, I'm going with youth. You would be able to download all of our data for just these specific metrics. You can say, I want all states, or you can select states. You can include data down to the census tract level if it's available. And then similarly, if you're, say you're working in a particular state, maybe it's California, Kentucky, or Florida, or another one that I missed, Washington. You can go in to that and then select some metrics from there, include all metrics, and again, download the data for states, congressional districts, or census tract if it's available. So that is the brief sort of demo overview of our website. I might have missed, I know I missed one page on the site, but I'll circle back to that after I see if there are any questions. I know none in the chat, but just want to invite folks to type your questions into the chat if you have any. If you want to talk about how you're interested in using the dashboard, we'd love to hear about it. Or if you have any suggestions for us, now is a good time to share. This is our suggestion for citation. We have a question in the chat about if you're using it in research. So it can be data can be downloaded for further analysis, and then this is the citation that we've offered. I hope that answers your question. I had mentioned before, but I'll just say again for you, Kevin, when you first go to find this page through access the data, you'll have to just enter in a little information about who you are and why you're interested in downloading the data. And then you'll be able to get the citation. Any other questions? Okay, briefly, I'm just going to circle back to the health snapshots page. I missed kind of an important feature that we provide for everyone. What district was it in Washington State? The 5th. Okay. Thanks, David. Okay, so this is the health snapshot for Washington's 5th Congressional District. For every district, we also have this tab here called District Facts. And for this, you can see the population for the district, the total population, the breakdown by age group, race and ethnicity. And then you can also see cities in the congressional district that we have on our City Health Dashboard website. So I mentioned in the beginning that we launched the City Health Dashboard website before the congressional district, and really our goal now is to make sure really that folks have access to data at whatever level they need it. Sometimes when you're working at the congressional district level, you do need to also know about sort of cities within the district. So we thought this tool would be useful. And then at the bottom for every district, you can see the rep and senators. So that's just other useful information if you're looking for basic district facts. And that is it for our demo. But again, I just wanted to pause, see if there are any questions. I know I don't see any in the chat, but just want to encourage you guys to share questions if you have them. And if there's nothing else, I want to confirm, Dana, that you can see the slides again.
Yep.
Okay. So this is our last slide, and it's just a prompt for you to stay in touch with us. You can email us at the info@ email address here. Dana's just also posted it in the chat. You can subscribe to our newsletter. I really encourage you to do that. It's an easy way to stay updated. We just send monthly newsletters, so we're not spamming you. And then there you can also follow us on LinkedIn. Thanks, Nicole. Thanks, Judy. Appreciate your thanks. Thank you, everyone, today for joining.